Are thyroid nodules dangerous? If you see, thyroid enlargement is a very, very common problem. I'm sure you would have seen a friend or a relative with a thyroid enlargement. In fact, this very often we get inquiries whether these could be cancerous or these could be harmful. A simple answer would be most thyroid enlargements are harmless. Most of the time, the enlargement is physiological. When the body's requirement for thyroid hormone is more, say during pregnancy or during many other periods, where this one, the thyroid enlarges to meet this additional requirement. Some other time, due to the increased hormonal requirements and decreased hormonal requirements, these thyroid would form cysts. Most of these cysts are harmless and are called colloid cysts. They don't require removal. The next type of enlargement is inflammatory due to certain conditions like autoimmune thyroiditis. It can be a part of a multinodular goiter where the entire thyroid is enlarged and one particular nodule is seen in a dominant fashion. Only a very, very small percentage of thyroid nodules, I would say less than 1 or 2% of thyroid nodules are actual cancer. But you can consult a doctor to find out what type of enlargement this particular thing is. The doctor would, of course, examine you. The thyroid would be in the midline, just below the prominent bone there. After examination, we generally order a few tests. The simplest test would be an ultrasound of the neck region. This ultrasound will tell us whether that thyroid nodule is solid or cystic, whether the rest of the thyroid is normal, whether there is increased blood supply to this particular nodule, and whether there are other abnormalities like lymph nodes. A solid nodule, of course, would be a little more dangerous than a cystic nodule. Nodules which have more blood supply or associated with lymph nodes would be considered more dangerous. If the ultrasound says that it's a colloid nodule or a harmless nodule, then no further investigation is required. It can just be left alone and kept under observation. Those nodules which are more suspicious require additional tests, and usually this is in the form of a FNAC or fine needle aspiration cytology. Under this, a small needle is inserted into the thyroid nodule, preferably under ultrasound guidance. A small amount of material is removed and the pathologist sees this under a microscope and concludes whether it is harmful or not. Along with this, blood tests to see whether there is hyperfunction or hypofunction of the thyroid would also help to give a functional assessment. If the FNAC is inconclusive or says that there is something harmful, only in these cases would surgery be required. So, in a nutshell, if there is a thyroid nodule, you need not be worried as most of these nodules are harmless, but do seek medical attention to confirm that this is a harmless nodule. Only a small percentage of nodules can be harmful, and these are the ones which require treatment.